2020. This is my head to toe assessment for adult health. Scanning all our surfaces. And that's our smelling chart. So we begin by inspecting the skin of the head, face, neck, anterior and posterior chest, and the abdomen. Skin is intact, normal for ethnicity, it's dry. I don't see any evidence of erythema, edema, lesions, nevi, bruising, or scars. Then we're going to inspect the head. It's normal cephalic, midline, and symmetric. We're going to palpate the head and scalp. We're going to note hair dispersion and color. I don't palpate any depressions or see any infestations or any abnormalities. We're going to palpate the temporal arteries for any tenderness. Any tenderness?
No.
We're going to palpate the lymph nodes for any tenderness or swelling. Pre-auricular, post-auricular, tonsillar, anterior cervical, posterior cervical, submandibular, submental, and then supraclavicular. Then if you would open and close your jaw, we're going to assess for TMJ. I don't palpate any subluxation or any crepitus or clicking. If you could pinch your jaws. This is testing cranial nerve 5, which is the trigeminal nerve. And then we're going to do the sensory portion. If you could tell me if you feel a sharp or blunt tip. Close your eyes.
What?
And then we're going to test cranial nerve 7, which is the facial nerve. If you could raise your eyebrows, smile, frown, puff your cheeks, and pucker your lips. Good. And then we move to the ears. We're going to inspect the outside of the ears for any abnormalities. They're symmetric and in good position. We're going to inspect the auditory canal and tympanic membrane. The tympanic membrane is translucent and pearly gray. We're going to palpate the ear pinna and the tragus for any tenderness or abnormalities. And then we're going to perform our hearing test, which tests cranial nerve 8, which is the auditory nerve. We're going to start with the whisper test. If you could cover your right ear and then repeat what I say.
4, 8, 9.
Then cover your other ear.
7, 4, 9.
Good. Now we're going to do the Weber test. Place our on top of the head. Do you hear the vibrations?
Yes.
Equally on each side. And then our rhyme test. You can tell me when you no longer hear.
No. 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 No.
And air conduction should be greater than bone conduction. Now we're going to move to our eyes. We're going to inspect and palpate the eyebrows, eyelids, palpebral fissures for any abnormalities. I don't see any drainage or lesions. Our sclera is white. Our conjunctiva is pink. Then we're going to assess cranial nerve 2, which is our optic nerve. If you could look at the smelling chart on the wall and cover your right eye and read the line clears to you.
FELOPDL.
And then the other eye.
FELOPDL.
And then read it with both eyes.
FELOPDL.
And then if you'll turn towards me, we're going to test central and peripheral vision. If you could cover the same eye. And then tell me when you see my fingers.
Now.
Other.
Now.
Okay. Now we're going to test cranial nerve 3, which is oculomotor. We're going to use the pen light. Our pupils are reactive. We're going to test for accommodation and convergence. If you could follow my pen all the way to your nose. Good. And then we're going to test cranial nerves 3, 4, and 6 with extraocular movement, which are oculomotor, abducens, and trochlear. If you could follow my pen light without moving your head. Good. Now we're going to test for the red light reflex using the ophthalmoscope. Then we move to the nose. We inspect that the nose is midline and symmetric. We're going to test cranial nerve 1, which is the olfactory nerve. If you could close your eyes. Can you tell me what you smell?
Sharpie marker.
And then that also verifies that our nerves are patent. I'm going to palpate the maxillary and frontal sinuses. Any tenderness?
No.
Now we're going to move to our mouth. We're going to inspect the gums, lips, teeth, posterior pharynx, tongue, under the tongue, salivary ducts, and then we note that the patient's tonsils have been removed. We're going to test cranial nerve 5, 9, and 10, which are the glossopharyngeal and vagus. You could open and say ah. We have upward movement of the uvula. We're going to test cranial nerve 12, which is the hypoglossal. If you could stick out your tongue, and it's midline with no fasciculations. Now we're going to move to the neck. Our trachea is midline and symmetric. We're going to palpate our thyroid glands for any tenderness or swelling. And then we palpate our carotid arteries one at a time, which are 2+. Then we're going to auscultate our carotid arteries for any bruits, and we use the bell to do that. Now we're going to move to the posterior chest. You could turn around to the back. We inspected the back is symmetric. We don't see any deformities. We're going to palpate for any tenderness or abnormalities. We're going to palpate for equal chest rise and fall, which we have. We're going to test tactile firmitus. If you could say 99 each time you feel my hand.
99, 99, 99, 99, 99, 99.
And then we will percuss in the intercostals. We should hear resonance throughout. We would also assess for any signs of respiratory distress. I don't see any evidence of retractions, any tripod positioning, nasal flaring, tachypnea, cyanosis. Then we're going to auscultate. If you could just take a deep breath in and out each time you feel my stethoscope. look at the lateral lobes. Now we're going to assess for any lung consolidation, starting with egophony. If you could just say E every time you feel my stethoscope.
E, 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 E.
Now we're going to test bronchophony. If you could say 99.
99, 99, 99, 99, 99, 99.
Now if you could whisper 99. So there's no evidence of lung consolidation, so we're going to move to the anterior chest. If you could turn around. We're going to inspect that the chest is symmetric with no deformities. We'll palpate for any tenderness as well as equal chest rise and fall. We're going to auscultate the lung lobes. Now we move to the heart. We're going to listen over all of the valves, starting with the aortic, which is the second right intercostal space, the pulmonic, which is the second left, Erb's point, which is third left, tricuspid, which is fourth left, and then mitral, which is the fifth left. We're going to do those again with the bell, aorta, pulmonic, Erb's point, tricuspid, and mitral valve. We're going to locate and palpate the PMI, which is over the mitral valve. We're going to auscultate for the apical pulse for a full minute. With a rate of 65 with a regular rhythm. Not ask you to lie down. We're going to assess for any JVD, flat, and then 30 to 45 degrees. We don't inspect any heaves or lifts. I don't palpate any thrill. We're then going to auscultate over all of our valves again, starting with the aortic, which is the second right, pulmonic, second left, Erb's point, third left, tricuspid, fourth left, and then the mitral is fifth left. And then we'll listen again with the bell. We're going to move to our abdomen. Our abdominal contour is flat and symmetric. We're going to auscultate for any bruise with the bell over the aorta, the renal arteries, the iliac arteries, and the femoral arteries. I don't hear any bruise. Then we're going to auscultate for vowel sounds in all four quadrants. My vowel sounds are normal active. We're going to percuss in all four quadrants. Here we should hear tympany, except over the liver and spleen. We'll hear dullness. We're going to palpate for any tenderness. Then we're going to palpate our liver and spleen. Any tenderness, no enlargement. Ask you to sit up. going to assess CVA tenderness. You could tell me if you know any tenderness with this. We're going to move to our upper extremities. We're going to inspect the overall skin integrity of the upper and lower extremities. Our skin's intact, warm, normal for ethnicity. Don't know any lesions, scarring, bruising, or nevi. We're going to palpate and inspect the joints of the fingers, wrists, elbows, and shoulders. They're symmetric. I don't know any deformities or crepitus or nodules. I'm going to assess capillary refill, just less than 3 seconds. Our radial pulses are 2+. We're going to move to range of motion of the fingers. If you could make a fist, it's finger flexion, extension, hyperextension, and then together, abduction, adduction, and then finger opposition. Move to our elbows, flexion, extension, hyperextension, and then our shoulders, flexion, extension, hyperextension. You could grab each arm behind is inversion, internal rotation, external rotation, and then out to the side, abduction, adduction, and circumduction. And then for our wrist, we'll do flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Then we're going to test our sensory portion of the upper and lower extremities. If you could tell me if you feel a sharp or blunt tip. Close your eyes.
Blunt. Sharp. Blunt. 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 Sharp.
So our sensory portion is intact. We're going to test vibratory sensation over the ulnar prominence. As well over the medial malleolus. We're then going to test our hand grips. If you could squeeze my finger. Hand grips are 5 out of 5. Our bicep and tricep strength is 5 out of 5. And if you could push check shoulder girth, it's 5 out of 5. And then we're going to test cranial nerve, 11. If you could shrug against resistance. And that is the accessory nerve. And now I'm going to do the cerebellar test. If you could take each finger and do your thumb opposition again. Lay your hands out in front. Go back and forth. And then take one finger and touch your nose to my finger. Touch your nose, my finger, nose, finger. We're going to test diagnosis. If you could close your eyes. I'm going to hand you an object. If you could tell me what I'm handing you.
A pen.
And then graphaphasia. If you keep your eyes closed and tell me what I'm writing in your hand.
Number 3.
Okay. We're going to do our deep tendon reflexes, starting with brachioradialis, our bicep, our tricep, our patellar, Achilles, and then we'll test our Babinski reflex. Now we'll move to the lower extremities. We've already inspected the skin of the lower extremities, so we'll palpate the joints of the toes, ankles, knees, and hips. They're symmetric and will palpate any deformities, nodules, or crepitus. We're going to do range of motion of the toes after we check capillary fill. It's less than 3 seconds. Our dorsalis pedis and posterior tibial pulses are both 2+. We're going to do range of motion of the toes. If you could do flexion, extension, hyperextension, spread out, abduction, adduction, range of motion of the ankle. If you could dorsiflex up, plantar flex down, inversion, eversion, and rotation. We're going to do our strengths. You can dorsiflex and plantar flex against our knee strength and then hip strength. We're on 5 out of 5 if you'll stand up. We're going to do range of motion of the hips, flexion, extension, hyperextension, flexion, extension, hyperextension, out, abduction, in, adduction, abduction, adduction, internal and external rotation, and circumduction. In the range of motion of our knee, flexion, extension, hyperextension, flexion, extension, hyperextension. Then we're going to do our lumbar spine. If you could flex over. We're assessing for symmetry. I don't see any evidence of scoliosis. You can extend back up, hyperextension, lateral flexion, and rotation. Now our cervical spine, if you do flexion, extension, hyperextension, lateral flexion, and rotation. And close your eyes and hold your arms out. We're assessing the Romberg test. We're assessing for any swaying. Now if you could take a few steps out and then walk back heel to toe. Then if you could hop on each one foot.